now in the studio, Dr. Abubakar Daraka. He is a pharmacist, consultant and health sociologist. He is also a drug production and quality assurance specialist and fellow of the West African Postgraduate College of Pharmacists. You're very welcome to Nationwide.
Thank you very much. Thanks for having me.
All right. Obviously, the world continues to face complex, interconnected health challenges. Looking for solutions brings us to today's theme, which is Think Health, Think Pharmacy. Just talk to us to start off with about this theme.
Actually, the World Pharmacists Day is a commemoration and a platform that pharmacists globally use to highlight the importance of pharmacists in the healthcare system. The pharmacist, who is the custodian and the expert on medicines right from inception, that is at the level of development, we are responsible for creating the development of the molecule to its formulation, appropriate formulation for use either as tablet, syrup, or injectable. And at the same time, when prescriptions come, pharmacists undertake the review and the evaluation to ensure that there is no any incompatibility or interactions and guarantee patient safety so that when he takes the medication appropriately as instructed, he will get benefit. So the theme remains Think Health, Think Pharmacists. So you cannot have healthcare delivery without a pharmacist being the custodian of the important commodity, which is the drug, and the pharmacist remains the expert and the custodian of such commodity.
All right. Clearly, there are a lot of hospitals across the country, everywhere, in fact. Is there still, some will say, is there still need for pharmacists in society?
Definitely. In fact, one of the American presidents said clearly and categorically that if the world does not have a pharmacist, we will have created one. That is to say, and that is very clear during the COVID, how pharmacists used their community pharmacy and made medicines availability at the doorstep of citizens, because the pharmacist remains the most accessible healthcare professional globally, not only in Nigeria. It's in the pharmacy you will meet a highly knowledgeable healthcare professional who has the knowledge of the disease. Even though the doctor, the physician prescribes based on diagnosis, the pharmacist, having known the knowledge of the use of the medicines, guides the use. Because medicine is a poison. If it's not used correctly, then definitely it kills, and it kills the entire community. So the pharmacists remain relevant because he is the custodian and expert of drug knowledge and responsible pharmacotherapy.
All right, so lastly, doctor, the challenge of fake drugs is still very much in the picture. What has been done to combat this?
What we keep advocating at the level of Pharmaceutical Society of Nigeria and the West African Postgraduate College of Pharmacists is to educate Nigerians that ensure that you collect and pick your medication from a registered pharmacy. Like in all other professions globally, there is quackery. Especially here in Nigeria, you see how drugs are displayed in markets, in motor parks, by quacks, people that have no business with the essential and very critical commodity. So the message remains clear: think health, think pharmacists. When you need to fill your prescription, ensure you meet a registered pharmacist in a hospital or in a community pharmacy. And with that, you can be rest assured you know the source of your medication.
Definitely. Very, very important. Dr. Abubakar Daraka, pharmacist and consultant and health sociologist. Many thanks for taking the time to talk to us, and congratulations on this.
Thank you very much. Thank you.
All right, let's revisit the